think the mental health first aid provides a literacy tool for most people who really aren't familiar with how to talk about mental illness or substance use disorders, how pervasive they are, understand a little bit about what symptoms look like, what signs are. These are tools now for people to use in helping their loved ones or their colleagues or their friends get the help that they need.
Employers are a critical audience in all aspects of healthcare. You know, it impacts productivity, how physically healthy we are, how mentally healthy. I think business audiences and corporate audiences are incredibly important to the growth of mental health first aid because businesses are important parts of communities. And if we're going to have community impact, everybody needs to be at the table, and that includes the corporate world.
Employers should consider offering this because whether they acknowledge it or not, everybody is affected by mental health conditions. This course provides a conversation. It provides a way to acknowledge struggles and to acknowledge that things can change and get better. Employers are already losing productivity as a result of not talking about this, as a result of not addressing this.
Well, this thing is a no-brainer. Mental health first aid is a way of mitigating someone's crisis. And if that person's crisis is a colleague at work, you can bet that if you mitigate and help that person who's suffering that crisis, you're going to make them a more productive individual in the workplace. And it just makes sense that employers would want to, really bring mental health first aid to scale within their employee assistance program or what have you. So an ounce of prevention is worth a pound of cure, and that prevention is a toolkit called mental health first aid.
Recently had a mother who had a teenage son at home. She took the course under some duress. She was voluntold to take it. It was a mandatory training for her. She was the finance director at an organization, and she didn't see any relationship between what she does and having to take this course until she began to recognize signs in her own teenage son, was able to ask him about his thoughts on suicide and discovered that he had been suicidal. He did have a plan and he did have the means, and she was able to save his life.
If workplaces can embrace this conversation and allow it to be something that is discussed more openly, I believe that they would have more productive employees, happier, better teamwork. The benefits far outweigh any of the cost or time lost in allowing employees to go to this course.